Finally, we've saved the best for last. Each year, SNMMI showcases its Image of the Year, and winning the award is quite an honor. Joining us from Germany is this year's winner, Ganna Blazhenets. Congratulations on winning the Image of the Year award.
Thank you so much. I'm very grateful to the Society for recognition of our study and for selecting our abstract for this year Henry Wagner Image of the Year award.
Tell me a little bit more about your image.
First of all, I would like to thank all the cooperation partners and colleagues who contributed to this interdisciplinary project. Thank you. So our image describes the changes in cortical metabolism of post-COVID patients who were presented to our medical center, to neurologists with persistent cognitive complaints. And as the pandemic proceeds, it becomes increasingly clear that these neurocognitive long-term consequences they occur not only in severe COVID cases. So deficits like impaired memory, disturbed concentration, and other cognitive problems, they may persist well beyond the acute phase of the disease. And therefore, in this study, we have examined these changes and we showed that this impairment of frontoparietal cognitive functions, they're related to frontoparietal cortical hypermetabolism, as was shown on FDG-PET. And this was affecting about 2/3 of subacute COVID-19 patients who were presented with at least 2 new neurological symptoms. So we prospectively examined the cause of this impairment, and in part of the patients, they were followed up until the chronic stage of the disease. And fortunately, we saw that there was a significant improvement in the deficits in cognition from one side, and it was followed by almost complete normalization of brain metabolism. And as I said, it was approximately 6 months post-COVID. This project was interdisciplinary and it's a prospective study, and it was carried out with multiple departments of the Frieberg Medical Center. So it's my big pleasure to introduce you Dr. Jonas Hosp, who is the head of the post-COVID ambulance of the Department of Neurology and Clinical Neuroscience, with whom we have really closely cooperated on this project.
My name is Jonas Hosp. I'm a neurologist, attending physician in the University Hospital of Frieberg. I'm a neurologist. I see the patients and the symptoms to understand why the patients has those symptoms. I need the colleagues from the imaginary services that help me to have a look in the brains of the patients to see if there are any structural changes, and in the case of the nuclear medicine, to really see if the function is impaired and to give me really fine tools to see if there is something wrong within the brains. You know, without those colleagues, I couldn't do my work.
So what do you think makes your image significant for nuclear medicine now and in the coming years?
So we have employed FDG-PET to study these post-COVID deficits in neuronal function, and FDG-PET is an established biomarker. My marker of neuronal function as well as neuronal injury, and it's widely available. So it may aid the diagnostic workup and follow-up in patients with persistent cognitive impairment after COVID-19. So we think the physicians that are treating this in patients, they should be aware of this phenomenon, and they should include bedside tests evaluating cognitive function in their routine workup. So in consequence, I think this patient should be presented to neurologists and possibly allocated to cognitive rehabilitation programs. Our study is also an example of how widely used technique can add value in the assessment of relatively new disorders and also patient management in time of pandemics.
Tell me, what's next for your research?
It's first of all a big honor for me, and it's a big pleasure for me to be part of this award and to be listed among awarders. So I will continue to do my research. I'm currently at my postdoc position, so looking forward to new great cooperations and projects.